temporal lobe is bounded by the parietal lobe above it, as well as the Sylvian fissure laterally, the temporal pole anteriorly, and the occipital junction posteriorly. Below the Sylvian fissure is the superior temporal gyrus, and below that, the middle temporal gyrus, and finally, the inferior temporal gyrus. On the medial surface, you will find the hippocampal gyrus and the fusiform gyrus. Centrally, the structures comprising the limbic lobe are also seen. Now that you're familiar with the anatomy, let's take a closer look at some of the clinico-anatomic correlations in the temporal lobe. The temporal lobe contains the primary auditory cortex. Here, sounds received by the ears are processed and assigned significance. This is where hearing and sound interpretation occur. Below the auditory cortex is the associative cortex, which works with the auditory cortex to correctly interpret spoken language and is even involved in understanding written language. Hearing has bilateral representation, although there is a stronger contralateral component than ipsilateral. Cortical deafness is very rare and requires bilateral temporal lesions. The temporal lobe also contains Wernicke's area, which is important for the comprehension of speech. Damage to this region of the dominant hemisphere results in Wernicke's aphasia, and fluent speech occurs without meaningful language being conveyed. This is the so-called word salad. Often these patients have a receptive component, meaning they have difficulty understanding language as well. The arcuate fasciculus is a bundle of fibers connecting Wernicke's area in the temporal lobe to Broca's area in the frontal lobe. This is an important connection allowing for language interpretation and generation. Lesions of these fibers produce an associative aphasia with inability to repeat and difficulty writing language. The limbic lobe, commonly referred to as the seat of our emotions, is a complex series of structures located in the medial temporal lobe. These structures connect in sequence to form the circuit of Pepys, which includes the hippocampus, the hippocampal gyrus, the mammillary bodies, the cingulum, and the fornix. Memory and emotion are linked in our neuroanatomy. The hippocampus is also involved in creating memories, which it does through connections with the thalamus. Bilateral hippocampal lesions, or lesions to the dorsal medial nuclei of the thalamus, can result in impairment of memory functions. Clinically, this becomes evident in Wernicke-Korsakoff psychosis, where thiamine deficiency due to alcoholism or other nutritional deficiency states can result in bilateral damage to the hippocampi and the mammillary bodies. A prominent feature of this disorder is inability to remember from moment to moment. This sometimes results in confabulation. Other features of Wernicke-Korsakoff psychosis include abnormalities of extraocular movement, called ophthalmoplegias, due to effects on the tectum and the mammillary bodies. Appendicular and gait ataxia are also common due to damage to the cerebellum. Radiations of the optic pathway pass through the temporal lobe, and these fibers are known as Meyer's loop. Lesions of this region of the optic radiations results in superior quadrantenopsia, or a loss of vision in one upper quadrant of the visual field. This can be seen with mass lesions, stroke, or even inflammations such as with multiple sclerosis. Temporal lobe epilepsy is the most common form of focal epilepsy. It is classified as a localization-related epilepsy, and as such, its manifestations are closely linked to the function of the region involved. Temporal lobe epilepsy includes a higher risk for memory and mood difficulties. While the birth and development of individuals with medial temporal lobe epilepsy is normal, the seizures often start in the first or second decades of life, sometimes with a first generalized seizure, a fever, a structural abnormality, or some other early injury to the brain. Temporal lobe seizures can have many manifestations which we could predict from this lobe's functions. These include visual or auditory hallucinations, automatic behaviors, déjà vu or jamais vu, olfactory hallucinations, and a clouding of consciousness.